In today's 2-minute top tip for our 30-day challenge, we're going to discuss injections and osteoarthritis, specifically what the evidence tells us about when and how they should be administered, because unfortunately they are administered all too frequently and potentially inappropriately and unnecessarily by certain health care professionals. So we're going to discuss that right now. So when should injections be administered? Now, for the majority of us, we should be attempting a conservative treatment program first. Now, the core of your conservative treatment is going to be weight loss if necessary, exercise, education, advice, tips and strategies about how to manage your joint pain, maybe in conjunction with some medication if necessary. If you have tried that for an adequate period of time and you have not reached a level of function that you're happy with, then at this stage, you could consider a steroid injection. Another instance when it could be appropriate would be if your symptoms are just unfortunately too irritable, too severe, too significant to attempt any of the conservative types of treatment. So if you're in too much pain to tolerate exercise, an injection could be appropriate to try and reduce your symptoms for a short period of time, not as a quick fix, but so that you can then reattempt the conservative treatment. In addition, if you have tried the conservative treatment and it hasn't worked and you do have an injection, it's still a good idea to continue the rehabilitation alongside that injection in the hope that it gives you a window where your symptoms are slightly better so that you can maybe progress the exercise slightly further than you were able to previously. It's important to note that an injection is not a quick fix. They have potential side effects like bruising or swelling or infection, albeit these risks are quite low. But the other thing is we don't know how long they're going to last for. Some people find that they last for 6 months to a year and they have a really good outcome. Other people find they last a few weeks, and other people just find that they do not work at all, which is why we try not to offer this as a first line of treatment. And if you are seeing a healthcare professional that is offering an injection to you as a first line of treatment, it's very unlikely that they are adhering to what the evidence suggests about how we administer injections. If, like me, you would like to spread some osteoarthritis positivity and you are wondering where I got my hands on this, I put together a little online shop with various arthritis inspiration and motivation. So if you would like one, there's a link in the description below the video to the shop. Question of the day: have you had an injection for your arthritis and did it help? If so, how long for? If you have enjoyed today's video, you can show your appreciation by giving me a thumbs up, which really does help. And if you're new, subscribe to the channel so you get notified every time we release new osteoarthritis related help. And whilst you're doing that, I'll see you in the next one.